Picture this. You're in the doctor's office, concerned about your child's ADHD symptoms. You discuss various factors, fill out many forms and questionnaires, but there's one question that often goes unasked and holds the potential to be a game changer. Intrigued? Well, let's dive in and discover what this question is. By the end of this video, you'll understand why asking this crucial question is vital for children with ADHD symptoms, as it can change the whole course of treatments and even your child's quality of life down the line. So whether you're a concerned parent, a healthcare professional, or someone who wants to gain an understanding of ADHD, this video is for you. Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder that affects many children. However, there's an important aspect we often fail to address during evaluations: their sleep. It turns out that children with underlying sleep apnea can demonstrate symptoms that mimic ADHD, leading to misdiagnosis and potentially hindering their path to proper treatment. Sleep plays a crucial role in your child's overall health and well-being, including their cognitive function and behavior. When children experience poor sleep quality or suffer from sleep disorders like sleep apnea, it can manifest as symptoms resembling ADHD. This can lead to confusion and misdiagnosis. So what is sleep apnea? Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breathing during sleep. These breathing interruptions, which can typically last 10 to 20 seconds, can happen anywhere from 5 to more than 30 times in 1 hour. Every time your child stops breathing, even for a couple of seconds, their brain slightly wakes up, which leads to disrupted sleep. This can affect up to 6% of the pediatric population. Untreated sleep apnea is associated with several complications, including neurobehavioral changes, growth and developmental delay, cardiovascular dysfunction, and insulin resistance. Major risk factors for sleep apnea in children include big tonsils or adenoids or obesity. So how can you suspect if your child has sleep apnea? Here are the signs to watch for. Snoring, although not every child snores, or heavy breathing, sleeping with an open mouth, poor attention span, behavioral issues, restless sleep, bedwetting, daytime sleepiness, night sweats. Last but not least, ADHD is among the neurobehavioral consequences associated with sleep apnea. A recent study showed that the prevalence of sleep apnea in patients with ADHD is higher and can go up to 30% compared to the general population, which is only 3%. US guidelines actually recommend that children who are undergoing evaluation for ADHD are assessed for sleep apnea, which is huge. There are actually 3 ways sleep apnea can affect children and contribute to ADHD-like symptoms. Number 1, fragmented sleep. Children with sleep apnea often experience fragmented sleep due to disruptions in breathing patterns. This fragmented sleep can result in daytime sleepiness, difficulty focusing, and reduced attention span, which can resemble ADHD symptoms. Number 2, behavioral challenges. Fragmented sleep and sleep deprivation caused by sleep apnea can lead to irritability, mood swings, impulsivity, and inattentiveness, which are commonly associated with ADHD. Number 3, poor school performance. Sleep apnea can actually impact a child's ability to concentrate and learn, leading to academic challenges. This decline in school performances can be wrongly attributed solely to ADHD, missing the underlying sleeping component. So this brings us back to the important question we often overlook. How's your sleep? By asking children with ADHD-like symptoms about their sleep patterns and quality, we open the door to a potential breakthrough in their diagnosis and in their treatment. So before prescribing any medication for ADHD, it is very important to address your child's sleep. Surprisingly, the most common and effective treatment is actually adenotonsillectomy, which is the removal of adenoids and tonsils in children with big tonsils and adenoids. According to multiple studies, this treatment can improve ADHD symptoms, cognitive and behavioral problems, learning difficulties, and quality of life. So if your child is displaying symptoms of ADHD or has already been diagnosed, but you suspect an underlying sleep issue, consult with a healthcare professional who specializes in sleep medicine. They can actually guide you through a thorough evaluation and help determine the best course of action. So if you have any questions or concerns about your children who have ADHD symptoms or sleep disturbances, don't forget to book an appointment. I'll put the link in the description down below.